Hello, everybody. On behalf of the Swiss Agency for Development and Cooperation, here after SDC, I would like to welcome you also at this Esther Switzerland Forum. I'm very, very pleased to have the opportunity to say a few words. I will just focus on the SDC approach to health, and then I will discuss a bit why does SDC collaborate with Esther, and then how do we collaborate with Esther, and finally, what are our expectations towards Esther. So to start with, maybe I will show you, it's a little bit dry. How does it work? Like this? Yes. So this is a bit the frame which explains how and what SDC is doing and why do we exist, in fact. See here the existing global health challenges and the new global health challenges. You all know them, so I will not detail them for the sake of time. And then, of course, our main frame is, first of all, the follow-up of the MDGs, because the work is not finished. And in addition, we have now a new frame, which is the Sustainable Development Goal, or the Agenda 2030, which is the frame for all the UN member states now, and which is very fit to address all these old and new challenges, because it's a lot broader than the MDGs. And then, of course, Switzerland has a Swiss health policy. We have a foreign health policy, and that's a particularity. We've been one of the first countries in the world to develop a foreign health policy. And we also have all the Swiss know-how and resources, and you are representing them here, partly, because Switzerland has a lot to offer in the field of health and global health. And then, of course, if we come to SDC, then we have three levels. We have, first of all, as a frame, we have a law on cooperation with developing and transition country. It's from 1976, and for the transition countries, 2006. And then our mandate is, as development agencies, to reduce poverty and social inequalities. And how do we do that? So we need first to define our strategic objectives every 3 years, and then we ask for a credit to the Parliament, which is called the Dispatch to the Parliament on International Cooperation. Now we are in a 3-year period which goes from 2017 to 2020 with the dispatch, and health is part of it as one of the thematic area. So SDC has developed also its own health policy, and well, the aim is to improve population health with a special focus, of course, on the most vulnerable people, because that's our mandate. And then we have 3 pillars. One of them is health system strengthening. Another one is the reduction of communicable and non-communicable disease. And then maternal, newborn, and child, as well as sexual and reproductive health and rights. So those are the pillars of our work in health. And this leads all our bilateral as well as our global interventions as Swiss Agency for Development and Cooperation. Now we come to the second question. Why does SDC collaborate with Esther? Well, the European Esther Alliance and Esther Swiss is an important player, or has become an important player, with an increasingly strategic approach. It started very focused on its broadening, and then it's in line with SDC objectives and priorities. And also, it's also in line with our efforts to promote the Swiss expertise and the Swiss know-how. How does SDC support Esther? Well, in 2 ways. Not surprisingly, first, financially. So we give about $500,000 Swiss francs a year for projects and for the Secretariat. And then 2,000 a year for the Esther European Alliance for the development of and the implementation of their strategy. And then we also are very engaged, as you may have noticed, in the steering group through Susanne Amsler, who is here, and also at the board of the Esther European Alliance. And we also try to develop synergies as far as possible between the Esther Switzerland project and the SDC focus country, when both are intervening in the same countries. And then we also use the results from Esther, Switzerland projects in policy discussions. Then what are our expectations toward Esther? Maybe you know this African saying which says, it needs a whole village to educate a child. We could say the same for health. We could say it needs a whole system to ensure people's health-centered services. And that's why the first thing is we are always considering as a governmental development agencies the necessity to promote changes and beyond partner hospital and targeted projects to have a systemic effect. I guess you have heard that already before, but that's really one of our priorities. And then beyond training and capacity building, the big question is sustainability. We can have a wave of effect and then it goes down, so how to maintain that? And then the last point is the reverse innovation. I'm sure there's quite a lot of potential for that. We can learn a lot in the partnership and bring the innovation to the north.